Recently, a global study, State of Global Air 2020, has been released by the Health Effects Institute. It highlights that air pollution is the largest risk factor for death among all health risks, and it is the first ever comprehensive analysis of air pollution's global impact on newborns. HEI is an independent non-profit research institute funded jointly by the US's Environmental Protection Agency and others. India, Bangladesh, Pakistan, and Nepal are among the top 10 countries with the highest PM2.5 particulate matter exposure in 2019, and all of these countries experienced increases in outdoor PM2.5 levels across 2010 and 2019. India is also among the top 10 countries with highest ozone exposure in 2019. Also, among the 20 most populous countries, India recorded the highest increase, 17%, in ozone concentration in the past 10 years. Long-term exposure to outdoors and household air pollution contributed to over 1.67 million annual deaths from strokes, heart attacks, diabetes, lung cancer, chronic lung diseases, and neonatal diseases in India in 2019. Pradhan Mantri Ujjwal Yojana, National Clean Air Program, introduction of BS4 emission standards, implementation of the Graded Response Action Plan. High PM contributed to the deaths of the more than 116,000 Indian infants who did not survive their first month. Infants in the first month of life are already at a vulnerable stage, and a growing body of scientific evidence supported studies in India indicates that particulate air pollution exposure during pregnancy is linked to low birth weight and preterm birth. More than half of these deaths were associated with outdoor PM2.5, and others were linked to the use of these solid fuels such as charcoal, wood, animal dung for cooking. Although there has been a slow and steady reduction in household reliance on poor quality fuels, the air pollution from these fuels continues to be a key factor in the deaths of these youngest infants. Addressing impacts of the air pollution on adverse pregnancy outcomes and newborns' health is important for low and middle income countries, not only because of the high prevalence of low birth weight, preterm birth, and child growth deficits, but it allows the design of strategic interventions that can be directed at these vulnerable groups. Although the link between air pollution and COVID-19 is not completely established, there is clear evidence linking air pollution and increased heart and lung diseases. Also, there is growing concern that exposure to high level of air pollution during winter months in South Asian countries and East Asia could exacerbate the effect of COVID-19. Average pollution levels in India are declining over the past 3 years, but these have been marginal, particularly in the Indo-Gangetic plains, which see extremely high PM pollution, especially during winter. After a decline in pollution due to the nationwide lockdown after March, pollution levels are again rising and air quality is dipping to the very poor category in several cities.